we're very, very concerned about what is going on with the health care that is going to be available in our future. As you know, the health care is officially called the Patient Protection and Affordable Plan. Everybody knows it more as Obamacare. So with your permission today, I will refer to it as Obamacare. It came through his administration. It came through Congress during his time in office. And for the same reason that everybody identifies Romney Care with the universal health care system in Massachusetts, we will be talking about it not in a negative connotation by calling it Obamacare. I'm Pam McDonald. I have been a practice administrator and working in the healthcare field for over 40 years. I have a private business. I'm a medical business consultant, and I use my skills to help physicians stay in practice and navigate through all of our mandates and rules and actually the part about being in business. One thing that people don't realize is that a doctor's office is a small business. We're in the business of providing health care. But for whatever reason, doctors hate to be connected to the business part of it. So they call what they do practicing medicine. They practice medicine. They're not in the business of medicine. They're not practicing anything. They've been in school for 14 to 16 years. And in the case of Dr. Tachibana, who will be talking to you today, over 30 years, Dr. Neil Wilson, who has been practicing and is now retired for 35 years. Not practicing. They're providing health care to all of you. Their ability to do so is very threatened. Today in our discussion, I would hope that you would get some answers to what is really going on, because you're not getting it from the media. You're not getting it from anyone, and you're certainly not getting any square answers from Congress. They certainly passed this bill without reading it, and the implications are horrible. We had a handout today of just a few of the, this is a simplified version of it, but it was taken off of the act that itself. Now, there's over 2,000 pages in this bill. Very little of it deals with the actual health care. And so part of it is implementation, and part of it is how they're going to pay for it. Today, Dr. Tachibana, myself, and Dr. Neil Wilson, together we have over 100 years of experience. So I hope you will take what we give you as expert information, because we want to portray to you our side of the story, what we're seeing from our aspect, and why you will soon see the implications by not having a provider, not having a doctor, because they are going to be unable to continue in their business of providing health care to all of you. Are of the age that you remember that when the days when it was just between you and your physician. You go to the doctor and he took care of you, and you paid your bill, and you had insurance, and you submitted to your insurance, and you may or may not have gotten a portion of that money back. All of us have worked all our lives, paid into the Social Security and Medicare, involuntarily, by the way, paid into the Social Security and the Medicare fund. We've come a long ways from the days where it was between the doctor and the patient. In the 80s, we had the advent of HMO, or managed care. This was the step into where we find ourselves today. No longer was it between you and your physicians. There were other people there that were not only telling the physician what he can and cannot do in the terms of treating you, but at what rate of reimbursement that you were going to receive. It's put another entity in between your health care, your doctor, and the decisions that are made for you, and who best knows what it is that you need. Now, this is the setup that you get with managed care, and we have it now. And we have it that the managed care has also taken Medicare under its wing, and Medicaid as well, and they administer that too. So now we have the patient, and the patient or the employer pays the premium to the insurance company. The insurance company has no liability whatsoever to you. They sell it to a managed care firm, the entity. Some of you will know these names because they're prominent here in Sacramento. By the way, Sacramento is where this all started. But we have Hill Physicians. We had Golden State Medical Group. We have Sutter Medical Group. We have UCD Medical Group. These are all HMO. Some of them are hospital-owned. Some are physician-owned. But whatever it is, this is what they are. So you have an insurance company that sells your patient life to the managed care. And the managed care then contracts with the doctors, and they pay that doctor so much money, X number of money, to take care of you. The primary care doctor is the gatekeeper now. He is the one who has to refer you to a specialist. You can't go to a specialist. I mean, if you have a PPO, this is not the way it works. But if you have an HMO, which is the most affordable health care these days, Kaiser is another, self-funded, by the way, HMO. So you go to your primary care doctor, your general care, and if you need to be referred to a cardiologist, or if you have to go have tests, or if you have to go to the hospital, that doctor must request permission, authorization from not another doctor, but a nurse who sits and approves whether or not you're going to have that type of treatment. And that approval is based on financial interest only. Can they afford? Does your plan pay for this? And then, therefore, he can send you to your specialist, or he can send you out for labs, or he can send you out for a CT scan or MRI scan. The liability continues to lie with the primary care physician. So if anything goes wrong, it's his malpractice, it's his lawsuit, he's the one who's liable. And this is by design, because the insurance companies have divested themselves of any responsibility whatsoever of you. Now we're seeing ourselves go into Obamacare. This is the structure. This is the bureaucracy that has been set up. This is why it takes $500 billion, $500 billion to even get started, and now they're finding that that isn't even enough. Look at this. The middle of the person, we have always had the Centers for Medicare and Medicaid. They have always dictated to doctors how much they can make, how much our fee schedule is. And it's based on SGR, a sustainable growth rate formula. The secretary, Catherine Sebelius, of the Health and Human Services, I like to call them the Health and Human Sacrifice Department. But this is what you get when you get government in anything. Now, does any of you know of anything that the government has done well, better than the private system? I don't think so. I mean, they can't run the post office, they can't run anything. I just wanted you to get an idea of the bureaucracy that the physician's office and that you are paying for. So we're facing cuts now in Medicare that are going to make it unsustainable for the doctor's offices. We cannot continue to do business this way. We are looking at two methods of their taking that $500 billion out of Medicare, out of the Medicare fund that doesn't exist anymore. And this is why we are facing certain cuts in reimbursement. Okay, this is what CMS does for us. The Department of Health and Human Services, they determine our allowable fee schedule. They price fix. They always have. That has been adjusted in the past by the area that we're practicing in because it costs more to do business in some places, like California and like New York, and than it does in the places in the Midwest where they generally have a shortage of physicians and healthcare services for you. They enforce the rules and the regulations, and they assess penalties and fines for violations. And we must be compliant at all times. Right now, they have we are undergoing a tremendous change. We are mandated to all be on electronic medical records by January 1, 2012. These records are difficult for the physicians and the practices to use. They slow down productivity. If you've been to your doctor that has one already, you know that you talk over a computer and that they look up your records, but what you don't know is that the government now has the right and is actively taking your information and putting it in a data bank to adjust your risk. It's just like your insurance for anything else. They're going to adjust the risk and your premium will be adjusted accordingly. And Medicare, Medicaid is outside of Obamacare for now. But everybody has to, all of the doctors have to comply with this. Now, this electronic medical record system is fraught with problems because some of these systems have been hacked into in Southern California. I don't know if any of you heard this. 38,000 patients had their records hacked into, and they had every bit of information. Everything. We have your social security numbers, your addresses, your entire health history on these things. And there's no way we can be secure. So it's a violation of our privacy. It really is. Oh, by the way, these systems, they cost a minimum of $100,000. Unless they're subsidized by someone. In our case, in our office, it's subsidized by Hill Physicians and the Catholic Healthcare West, the Mercy Hospital systems. But it's onerous. I don't know what a lot of these smaller physicians are going to do. They're going to have to use a system and rent it, I guess. I don't know. But you know, this is just one more thing that we're faced with. There's two cuts coming down the road for us. Reimbursement for your doctors, for your healthcare providers, that is going to put us out of business. Before I talk to you about the sustainable growth rate and the method that is currently used by CMS to control it, the costs of providing healthcare, spending on healthcare, is that a week ago Monday, we found out that the Medicare Payment Advisory Commission has to start making $500 billion worth of cuts now. The cuts are in the real pay of the specialists and the primary care physicians. The specialists, your cardiologists, your oncologists, your neurologist, your orthopedic surgeon, your GYN, all of them, their pay is going to be cut by 50% over the next 10 years. 25% reduction over the next 3 years for your primary care physician. If any of you think that a primary care physician is rich, you're wrong. They make less than a plumber or an electrician. They never have been on top of the food chain, if that's what you want to call it. They're struggling to survive. And that's one of the reasons why we're going to start seeing a shortage, because we have no students coming out to be primary care physicians. Very few, because they can't survive with what they come out with after spending 14, 16 years in school. So this was so wrong, this cut, that a lot of people wrote to their Congress people protesting this. And seniors, please, please. Something came up. Barbara Boxer I sent a letter to her. She sent me back a response. And she said, due to the overwhelming response that we've had on this, we've decided to make this effective or talk about it December 31st of this year. So they're kicking it down the road, and they'll continue to kick it down the road because they want to get reelected. This is both sides of the aisle, folks. I'm not being political here. I'm just saying what is. You can thank your Congress for this, for passing this bill that they never read and had no idea what it was about. Okay, now we have another cut in reimbursement. It's the sustainable growth rate cut that we have been kicking down the road for years because it has to increase because the cost of medicine increases. And so now, last year, they just stopped paying us while Congress went on vacation and said they would decide when they got back. When they got back, they decided to kick it down the road again, extended it down. And so if you can imagine, if any of you have been in private business before, you can imagine that suddenly you do not have any accounts receivable to cover payroll, to cover your expenses for 45 days or more. And we cannot go out and borrow money because banks aren't lending short-term business loans. So where does that leave us? We struggle. It's been a nightmare. I'll tell you that a lot of physicians that are practicing today, there's a lot less of them. 60% less, in fact. When we moved into our complex in Sacramento, it's a medical complex. We're the only doctor's office left in that complex today, 4 years later. This is what's going to happen, and this is what we're concerned about. We're not only concerned about the fact that we can't practice medicine anymore, but that you will not have a doctor to treat you. You will be seeing mid-levels. And Dr. Tachibana will explain all of that to you. This is what's going to come across the board, even if you're not on Medicare. But guess what? What are the doctors that are going to try to survive do when these cuts come? Who's the first people they're going to stop seeing? People on Medicare, people on Medicaid. California, they're already doing that. That's so that they can continue to see the patients that they have, or maybe they'll even let those go. But as I told you, they set or fix our prices, so commercial insurances are very quick to follow suit. They renegotiate our contracts, and then they pay based on what we get paid from Medicare. So we're done. There's no way. We don't want to do this. Dr. Tachibana's been practicing for about 32 years, and he doesn't want to say goodbye to the patients. He's still seeing patients that he delivered 30 years ago, and their kids. He's established a relationship with them, and that will no longer be possible. This one is looming and growing every time they kick it down the road and decide whether or not they're going to do away with it permanently. So I already told you what these cuts are. This is across the board. This is across the board. This is not just doctors. This is all healthcare providers. This is your hospitals. This is your nursing homes. This is devastating. The hospitals are wringing their hands about how they're going to be able to stay open, because Obamacare has allowed illegals to be covered under their insurance. They're allowing in California for them to be covered because by virtue of walking into any hospital in California, the California law says you treat whoever walks in that door. We as providers are no longer allowed, when we take and accept a patient, to ask for ID. What they do is they take their Medicare card or their Medi-Cal benefits that is fraudulent, and they pass it around to all the family members that happen to be female in there. And we can't check eligibility. The government doesn't have the capability of checking eligibility. So we're paying for this. All right. Can you imagine having your income cut by 30% and still paying your bills? This is on top of that other cut that's coming. Could you possibly survive if somebody said, you're going to get 80% of your income cut, and by the way, you still have to pay taxes on that other 20% that you get? So this is the thing that has us so upset, because we are, if Congress doesn't act on this by November the 15th, that's the deadline, they're going to kick it down the road again. I guarantee it. And then maybe not. Maybe not. Because the super committee has to come up with $1.4 trillion worth of cuts, and guess where they're going to look? I guess you're asking, where does all our money, where did it go? Where did all the money that's been coming out of our paycheck that we've paid into all these years for Medicare and for Social Security, where did it go? I've been asking that for a long time. And I don't know about you, but I'm really, really, really mad, because I have been working since I was 16 years old. And I thought it was going to be there for me when I got there. Well, the trust fund is an imaginary thing these days. It has been since Lyndon Johnson was president. He had an agenda that he had to pay for the Vietnam War. And they didn't have the money then. And so Congress enacted a bill that said that they could divert the money that was in the trust fund. They literally broke it, and transfer it to the general fund to spend as they needed it, because they needed some money. And this has been going on. We have been stolen from since then, in every administration. So you just figure it out. Did anybody know this? I didn't know it. I didn't know this was going on. I've been living in the fantasy world with everybody else, thinking that there was a trust fund, that it was going to be there so that I could get my Social Security. And by the way, I'm just 1.5 years away from it. What about the people behind me, the other baby boomers that paid into it and will never see it? What about our kids? I mean, it's sad. And so this is what happened to it. It isn't there. What is there in that Social Security Trust Fund is $3 trillion worth of IOUs. That's why they're trying to get the money now to pay for this Obamacare. This socialist healthcare reform. And I'll be the first of you that I would tell you that socialized medicine doesn't work. It didn't work in Europe. It didn't work in Russia. It didn't work in Canada. It didn't work in England, UK, France. And they're all going, oh my gosh, Do you know that they used to come down here? They still do. Canadians come down here for surgery. We have the 5th best hospital in the nation for cardiac surgery. And they come down and they pay cash because they go on a lottery. Only so many surgeries will take place in the year. It's all financial driven. We're starting off with this thing in a negative, a huge negative. We're getting rid of all the doctors that are capable of doing these surgeries. We're getting rid of all of the pharmaceutical things because everything is going to be generic. There'll be no more research. We know this because we've been talking to pharmaceutical reps when they come in, and they're all losing their job. By 2014, actually it's already happening, by 2014, Big Pharma has about 3 or 4 of the big major players, and these are the people that manufacture vaccines. Big Pharma is stopping all studies and all research on any new drugs because it costs so much to bring a drug to the forefront. This is at a time when we have these fantastic gene therapy results going on at UC Davis for the treatment of cancer. We're on the cusp of having a cure for these diseases, and they will stop because there's no funding for it. 128,000, they project, pharmaceutical representatives come out and educate the doctors about their products are going to be laid off. The jobs are gone. And I can tell you that once the doctors are gone, we won't get them back. Because if they retire, it takes 14 years minimum to train a new doctor. So if we don't make these changes very soon, we're all in big trouble. Okay, there's some entities that just was uncovered that stood to benefit a great deal by this Obamacare. They have a $5 billion fund to shore up the early retirees. They went to entities like UAW, the Associated Press, Huntsman, the Teachers Retirement System in Texas, and the State Texas Retirement System Fund, Pension Fund. 30 million of it went. This is our taxpayers' dollars, but they handed it out because Governor Perry has been against this Obamacare. He wants the state sovereignty to opt out. Now, there has been a significant rise in the healthcare premiums for employers and for people who buy insurance. How do I turn this off? This rise in premiums, I can give you an example. It comes because there's going to be a cap on the increase in premiums after Obama takes place in 2014. So now they want to get to that point where if they're cut off, when they have to start taking everybody, they're negotiating between themselves. I can tell you who these big insurance players are. They're Kaiser Health. They're the Blue Shield. They're Blue Cross. They're United Health. And these are the insurance companies that are going to be in the exchange when this is all said and done. This is who you're going to have to pick. There'll be no more HMOs. There'll be no more PPOs. And they will take your premiums out of your checking account, your bank account. You will not have the opportunity to pay them or choose. So when Obama said you can keep your doctor if you like him, and you can keep your health insurance if you like it, was, if not a lie, it certainly was incorrect. So these insurance companies now are raising their rates. In our small office, we have 6 employees. We pay for our employees' health care plan. We experienced, when we re-signed the contract this year, of a rise of $9,500 in premiums over the year for 6 employees. How many employers do you think are going to continue to provide health care for their employees? Any kind of health care? None. It's a mandate for all all employers to pay 50% of the of employees that are 500 and 50 employees and more. Geez. And they're mandated to do it, and if they don't do it, they can opt out, they can be fined. Again, the government will dip into their account and they'll fine them, and it's directly associated with their payroll, because IRS is the instrument that is collecting the money, if you will. And they've been going crazy hiring IRS people that are just going to do nothing but collect money for health care. And we all know IRS. So the employers will stop providing any kind of health care coverage. Now, I probably, like you, I've been wondering, if Obamacare is so great, how come he has exempted 1,800 entities, businesses, states, labor unions? Why is Congress exempt from this? Okay? It's because Congress, especially the leaders in Congress, your speakers, your minority whips, your leaders, all have an allowance of $150,000 to own their own private physician who can go with them everywhere. And of course, these physicians would be delighted to do this. The president has $200,000 to pay for his own private physician, and by the way, he can have more than one. So they don't deal with this. The Congress elite don't deal with this. The uber rich don't deal with this because they can pay cash for it. They can own these physicians. They can own a hospital. No big deal if you go to the hospital and you do this. You know, you run up a bill of $500,000. Oh, yeah, chump change. Taxpayers will pay for it. Not only that, but your premium, the amount that you're going to be allowed to spend on health care is capped. Everyone will only be allowed individually to spend $5,000 a year. For a family, the cap is $10,000. Any of you walk into an emergency room lately? Wow, you can be that 10,000 mark with a little quick overnight stay and a few tests. So you better have some money put away. You better have some assets, or you're going to be making a visit to the, especially if you're on Medicare, mandated visit to the death panel. The end-of-life counseling that you will be required to go to every 6 months. And if you are over the age of 75, they will directly send you, and you go and you have cancer or you need surgery, life-saving surgery, they're going to send you to a different counselor, and they will try to get you to make a choice of, are you going to die from your disease on your own? Or are we going to assign you a physician to euthanize you, to end your life? I'm not joking. That is in the bill. That is in the bill. It certainly is. I will show you exactly where. Okay. You don't want to believe it? You think I'm telling you a lie? Please read the bill. It is in there. Okay. Actually, I could say more. I really wish you would not take my word for any of this. I've had a personal interest in all of this. And it frightens me. It frightens me for my kids and my grandkids because, by the way, I'm a grandma of 4, extended grandma of 5 more. I have 2 kids who are struggling, who don't believe what's going on right now. And I don't sleep at night. And I can tell you that God and I have had a lot of conversations over this. So I end this with a sadness, but in the same way, I wish you would go online if you have a computer. If you don't, find someone who does. Go to the library. You can pull up this act and read it yourself. There are several other sites that we deal with all of this. As physician office, we get the mandates. This is why I know what they're going to do to us. This is why I know about what we call the death panels. They're the end-of-life counseling, and they outline it. I can give you the page and the place to read it if you want. At the end of this talk, I'm going to have Dan tell you how you go on our website, and I can help you, or my telephone number is there, and I can help you research this. I never want anybody to take, this is not an opinion. I'm giving you facts. If I really wanted to give you an opinion, probably half of you would walk out of here. Okay? But this is facts. And at the end, I wish you would write your questions down if we haven't answered them. Because I want you to learn about what's going on. This is about waking up people. This is about telling you things that no one is telling you about. Not the press, not the media, and probably not your doctors. You probably go to your doctor and you say, "Hi, how's everything going?" He's again, "What have you got to going and today?" And he's gone with his thing and he says, "Oh, this is no problem for me. This is no problem for me because he's on a salary and he's working for one of these groups. And it isn't his concern whether they stay, just as long as he gets his salary." and that he can be a doctor, and that he can treat patients. But doctors, historically, are bad businessmen. They don't want to be bothered with this because they are very educated and they are very bright, or they wouldn't be doctors. But they're not taught anything about business. And that's why I'm a medical business consultant, because I've helped a lot of them survive all of these things that have come along the way. So, in conclusion, I'd like to introduce Dr. Ron Tachibana. And I think, you know, from the point of, from his viewpoint, I think you need to see a doctor as a human being, and you need to see his take and how he feels about what is coming down the road for all of us. And by the way, Dr. Tachibana is on Medicare and Social Security.